Welcome to the Dr. Francavilla Show. I'm your host, Dr. Carolyn Francavilla, board-certified family physician and diplomate of the American Board of Obesity Medicine. I've been helping patients lose weight to treat and prevent medical problems for the last 10 years, and I'm taking what I've learned from them to you. In this podcast, you will learn the science behind why you struggle with your weight and what to do about it, tips for common challenges, work to fight bias about what a healthy weight really is, and improve your relationship with food and your body. Please remember that while I'm a doctor, I'm not your doctor. This podcast is meant to be informational in nature only, not medical advice. Please seek out care from your physician for your specific needs. Okay, let's get started. Hello, and welcome to this week's episode of the podcast. Today, we are going to talk about a body part that doesn't get a lot of attention, your liver. When it comes to weight and health, one of the big impacts that extra weight can have for some people is liver damage. And in fact, fatty liver disease is quickly becoming the most common cause of liver disease in the world, and the most common reason that people are going to need liver transplants. So it's now outpacing hepatitis and alcohol abuse. So I have brought a guest on today to help me talk about liver health and non-alcoholic fatty liver disease, what it is, what we can do about it. So please welcome my guest. I have Emily Sutton, who is a pharmacist. She's a clinical pharmacist and specializes in chronic diseases with a focus on diabetes and obesity. She got her PharmD at the University of Iowa and did her residency at the University of Mississippi. She works with patients from all backgrounds in Vermont to provide equitable care and access to appropriate medications. So welcome, Emily.
Thank you. I'm so excited to be here and talk about something that people don't know a lot about. And it's almost like this great unknown of what's happening with the liver. What's this going on all the time?
Yeah, I agree. I think this is going to be a really educational topic, and I would encourage everyone to listen because this may be something you've never been told about and you don't realize is something that you should care about, because it really is a huge growing problem. So Emily, tell us a little bit about yourself. How did you get involved in helping people with weight, and how did you get involved and interested in liver health?
When I was a pharmacy student many years ago, and I was on a family medicine rotation, I noticed that we had quite a few patients that were inpatient that had liver problems. And I had always wanted to be an outpatient pharmacist, but it was just really shocking for me. I was like, how do all these people have liver problems? Like, surely not everybody in Iowa is drinking that much. Yeah. And so I started looking into it a little more, and I listened to this really good talk by one of the liver specialists there about non-alcoholic fatty liver disease. And I was really shocked about what they were talking about. And again, this was a long time ago. And they were talking about how people were needing transplants and people were inpatient. And I just could not imagine like what could be happening that it got that bad. Because I think when all of us picture someone with liver disease, we're picturing someone that has struggled for many years with alcoholism, different substance abuses, and at least more recently, like maybe hepatitis C or hepatitis B. That's what we're often really thinking about when we're thinking about liver disease. And I think we're much less commonly thinking about excess adiposity as it relates to liver disease. And so that kind of just stuck with me. And then I finished residency and came up to Vermont to practice. And we have, in my area of Vermont, we have a really large population of new Americans, and particularly new Americans that are like from different Asian countries. And as there is a kind of a different BMI threshold for people with Asian ethnicity. And so I started noticing that like a lot of our Asian patients would have a little bit more visceral adiposity at much lower BMIs. And we've had a couple of patients that needed liver transplants due solely to MAFLD. And it was, again, really shocking to me because I'm like, why would this 50-year-old who, when you just eyeball them, who doesn't seem to be that large or that full of adiposity, how are they getting so bad that they need a liver transplant? That is just so extreme. But it just shows that we don't always know what is going on behind the scenes, but it really made me so interested in this. And then seeing more and more patients strictly for obesity or metabolic syndrome type things, the more I've done that over the last few years, the more I've, seen this. And it's been really surprising. And I'm sure you see this too. It's often just an incidental finding, right? People they go in for some sort of abdominal ultrasound or CT, and they're like, oh, and look at that. There's some hepatic steatosis. There you go.
Yeah, absolutely. Yes. Because it's not something we necessarily screen for. So we can see it on blood tests. We can see signs of it on blood tests, right?
Mhm.
Sometimes there's no sort of standard screening protocol right now for this. So unlike diabetes, which most people are getting screened for on blood work, that we have a lot of medication options for, that I think almost everyone has heard about, this non-alcoholic fatty liver disease is something that is just really not part of our really medical protocols at this point to really be looking for. And part of it is because there's not like a big drug that's being pushed for this at this point. There's some trials going on, but the treatment really is weight loss, right? And I think it's
Mhm.
interesting that you brought up, because we see this for all the health conditions, right? Everything related to weight, that it's not a direct correlation. So it's not necessarily the people who have the most weight, the people who have the highest number on the scale or the biggest BMI, who are always going to have more issues with their liver. It can happen for people depending on sort of their genetics and their body at just a little bit of extra weight on their body. And so I think that's one of the things we see with everything, right? Some people will get diabetes when they have 10 or 20 extra pounds, and some people have 2 or 300 pounds they could lose and they don't have diabetes. So it's not always directly related to the amount of weight. And so really, this is something we should all be thinking about. I love hearing your personal stories and how you saw patients who really had struggled with this, and your curiosity to what
Mhm.
can we do for this? What is NAFLD? So what is this non-alcoholic fatty liver disease?
And actually, you probably didn't see this because it's one of those kind of study or like notifications that comes through in the middle of the night, but they're actually changing the name of MAFLD to MAFLD, which is basically, so they're changing like the non-alcoholic part to metabolic associated fatty liver disease in order. And they like, I think they didn't like having so much emphasis on the fatty part, even though the metabolic fatty liver disease is still
I
there.
think
But
that's where we need to move with everything, right? Like, it
yeah,
really is about this metabolic syndrome. We need to get
right.
away from these assumptions, because again, it's not always related to the amount of weight or fat someone has on their body. It really is how their body tolerates things metabolically.
Like making that nomenclature change allows them to better emphasize that as a metabolic process versus just a weight process in the absence of alcohol use or in the absence of significant alcohol use. And so obviously if MAFLD is suspected, they're making sure that it is actually that it's not like some other process going on. And typically, if it's not, the amount of alcohol that someone has to consume for it to be called like an alcohol related liver disease is a lot. It's pretty significant over a lot of time.
So what we're talking about is liver disease that's
Right.
related to metabolic syndrome, which is related to your body's tolerance of
Right.
adequate fat tissue, right? So again,
Right.
and for some people who don't have that high of a BMI, but their body doesn't tolerate that
Right.
weight. And what exactly is
Exactly.
going on in the liver? This is what's happening with for these people.
And we don't give our liver enough credit for what it does on a day-to-day basis. Our liver does so many things. We give a lot of credit to our kidneys for their filtering ability, but we don't for our liver. But the liver takes a lot. It takes a lot on. And so when we've got excess blood sugar, when we've got excess lipids, triglycerides floating through, the liver takes some of that. And after a while, it's not built to handle all of that. And so it becomes scarred and no longer as elastic as it needs to be to do the things that it needs to do. And so that's where we start seeing what we call fibrosis, which is basically scarring of the liver. And we have good liver. Like our livers are just like regenerative. They're made to handle a lot of abuse. I think a lot of us can point to places where we've abused our livers over time and now they're fine. And that's what makes our livers really cool. However, they do have a threshold at which they're just not going to be able to recover, or at least not fully recover. And so you see those scars on there. And whether it's MAFLD or alcoholic liver disease or other things, any injury that continues to insult the liver will create scarring. And over time, that is what creates our increased risk for hepatocellular carcinoma or liver cancer, or increases our risk for cirrhosis. And both of those things happen typically over decades. And that tells you how resilient that your liver is that it can take, decades of abuse before something, bad happens. And, after even a while, if there's the liver cancer or really bad cirrhosis, that's when they start talking about liver transplants. And liver transplants are so cool too, because they can just take part of somebody's liver and give it to you. You don't even have to have the whole thing. You can get a 50% discount and still have a functioning liver.
So most people will not progress to that, right? So when
Right.
we identify someone who has liver disease, this metabolic liver disease, we want to identify that so that we can do something. Weight loss being
Right.
our main intervention at this point. And we'll talk a little
Yes.
bit more about some of the things you can do to keep your liver healthy and to protect your liver if it's already going down this pathway. But some people will progress to more progressive stages, right? Where they have this fibrosis or like scarring and damage to the liver. And then some people's liver damage will become even more progressive where they have cirrhosis and liver failure and
Mhm.
actually may need that transplant. So trying to identify is all the people who have some of those early signs, right? Some of that, what we call liver disease, where we're like, your liver is not optimal. It's
Right.
inflamed, it's irritated, it's starting to have some scarring. Knowing that many of those people are not going to progress all the way to liver failure, most of them will not. But we don't know who those people are necessarily going to
Right.
be. So if we have these early signs, then we should be doing something to
Right.
prevent that progression. And
Right.
so
And I like how you talked about that, like those kind of two things to prevent, because when we think about what's coming out, what's out there, what are we trying to do, right? And help understand and help our patients understand when if we say you have these early signs of metabolic liver disease, what does that mean? What can we actually do? And all the studies look at typically two different things. And one is, does it improve the scarring on the liver? And then also, does it slow down or prevent the progression of the scarring? So those are two related but different things, of which, of course, if there was an ideal drug out there, it would do both. It would, not only stop, but maybe reverse some of the scarring. And then ideally, it would just put a full stop on any progression of the liver disease. And what's been so interesting is they've been throwing things at the wall for years, trying to find something to treat this with, because how many other disease states do we have that can be that serious that we're just like, I don't know, like we don't have a drug for that. Like we have stuff that can help the things that cause it or progress it. But like for this actual disease state, we don't have anything that actually treats it. And the most recent drug that went up for approval again was declined again. Like that was, I think, the second or third time they had put that up for approval, and it was declined because they felt like the side effect profile and the efficacy profile was not favorable enough to approve it for use. And it probably would have been quite expensive. And once again, like we may have these incredibly expensive drugs that may just prevent a little bit.
when we look at the data, they're just not worth it. We haven't found something that works
Right.
well enough. Number one, people don't seem to think the liver is a very sexy organ. Like we don't really talk about the liver very much, but also we don't really have a cure for this, right? And so there's not a lot of vested interest out there. There's no advertisements on TV letting you know about this because there's no drug company out there that has something yet. So there are continuing trials to go on. So if you are someone who has this condition, I always have hope. There are drug trials going on, and I feel confident that they will find things. But one of the most powerful things we have right now is weight loss for people with this condition. And what we see is that I think a 5 to 10% weight loss dramatically improves the health of your liver. And I've seen often that a 15% weight loss, if you can get to that weight loss amount, for most people, it's going to reverse this process.
Mhm.
And so
Yeah.
that's like really powerful information that there are tools that we have, even if they're not medications, that weight loss, this is something weight loss truly reverses for people. And again, this is not about getting to normal on that BMI chart, right? Your body's tolerance of the weight you have, and that we know somewhere around that 10% mark, some people may need more, very likely to reverse this condition. And a 10% weight loss, 10 to 15% is doable for many people.
It is. And I really also appreciate that in the guidelines that they talk about from the ALD, they specifically address that it's even less about just the weight loss and more about the maintenance. So they talked
Yeah,
about,
you have to lose it and keep it off. Yes.
because they set to like a threshold, they were like, people that lost 7% of their body weight had significant improvements, but they specifically note this, that only about, I think, less than 50% of the people in that trial were able to maintain that weight loss for any extended amount of time. But the ones that did had such significant improvements. And I think that is so important for us to continue to focus on. And it's not just about the loss, it's as important, if not more important, about the maintenance of that loss.
We always have to keep that weight loss going. We have to keep that weight off for any of the clinical improvements, right? So I
Right.
always emphasize that with any treatment plan I'm helping someone pick, it has to be sustainable. So whether that's a medication, a way of eating, an exercise regimen, logging, whatever you do to lose weight, you have to be able to keep doing to keep the weight off. And I feel like I say this over and over again in my clinic and over again on social media and places, but it's such a fundamental concept. Whatever you do to lose weight, you have to be able to keep doing. So quick fixes are just that, and they don't solve any of these underlying medical problems.
And I think so many people also have this number of what weight loss needs to be in their head to be healthy. And it's not often that number. So often when we talk about, even in the diabetes and pre-diabetes space, what that weight loss number needs to be, I always like to emphasize with people, like, they don't say you need to get to a BMI of 24.9. That is not what these guidelines are saying anymore. They're saying no matter where you started, a weight loss of this percent, it's usually 3, 5, 7, 10, 15. Like, each of those kind of benchmarks has a benefit in multiple disease states. Like, so no matter where you started, losing that will improve your outcomes, period.
Absolutely, yeah. And so whether we're talking about your liver or diabetes or
Right.
heart disease, cancer prevention, all of these
Right.
things, it really is not getting to normal on the chart. It's really where you're starting from and seeing an improvement from there. And everyone's body's going to respond differently, right? So,
Mhm.
I've seen people who they feel so much better and their cholesterol looks better and their liver tests look better with a 5% weight loss, and they've done something
Mhm.
that's sustainable. Great. We can stick there,
Right.
right? So there's no one size fits all answer to this sort of
Right.
thing. And so I think that's really key, because I think for some people, they have so much weight above that normal on the
Mhm.
BMI chart that it's really overwhelming.
Yeah.
And they feel like a doctor is going to tell them they have to lose 100 pounds. And we would never tell you you can't lose 100 pounds, right? You're welcome to lose that much if you can do that in a safe and sustainable way, but you may not need to, right? You
Mhm.
may have a huge health benefit from losing 20, 25 pounds. And
Right.
that is often doable. We start adding in medications and other
Mhm.
support tools.
Right. And it was interesting because, I'm obviously focused a lot on medications, but they did a study many years ago, and this was before some of our newer medications, really just looking at just the impact of weight loss medications on fatty liver. And it was really interesting that they didn't find a lot of benefit just using those medications. However, what they did find was lifestyle modifications was beneficial. And but those were when we had the medicines we have now
Yeah,
by
because
us.
I think there are studies going on for some of our newer
Mhm.
medications, our GLPs,
Right,
to see if we can get indications approval just for
right,
these liver diseases, to see if
right.
they are one of the medications that could
Yeah,
solve.
there's been good data with those newer injectable medications that supports their use. And overall, what they do talk about too, in terms of what is happening, is that there is an association with a pro-inflammatory state, which I think we all know goes along with metabolic syndrome.
So when you talk about
Yeah,
that, tell us about that inflammatory state, because I think that actually gets missed a lot.
it does. It does. And when we think about what happens when our body it is continuously bombarded with things it doesn't like. And that may be extra cholesterol, that may be extra blood sugar. And I like to explain it to my patients like when you have extra blood sugar flowing through your blood vessels, they don't like that. That's not what they want. And so it causes the little lining of the blood vessels to become inflamed because they're being irritated every time there's too much
Yes,
sugar.
we talk about that inflammation coming from is, and this is a different threshold for everyone, but when your adipose cells, your fat
Yes,
cells get too full, they start
right,
to become these very like filled up, leaky things, and they
right,
start leaking all this inflammation as
right.
well. And again, that threshold is different for different people. So
Yes,
when someone comes in and they say, I know I don't have that much extra weight, but I feel so achy and
right,
tired, and we look at their blood work and it doesn't look good, that is too much weight for their body. They've hit
right,
the threshold of that inflammation, and we may see it as
right,
blood pressure and liver disease and all these other
right.
metabolic
And
things.
we do. And that's part of what causes that scarring on the liver is it's become inflamed, just like our blood vessel. It becomes inflamed because it doesn't like having that extra sugar stored, it doesn't like having that extra cholesterol stored there. And so what we see is just this overall increase in cardiovascular risk. So you're much more likely to have a heart attack or stroke because your blood vessels are inflamed, your liver is inflamed, like all of these things are inflamed. And it's not like you can just take an anti-inflammatory pill to decrease this inflammation. And so even though that we don't have necessarily drugs that treat fatty liver disease, we do have some drugs that they know if you have diabetes and you also have liver problem, metabolic liver problems, that this actually does tend to pull some of that inflammation down overall. And even though you may not see huge results with things, it does decrease that. And so typically they will make recommendations saying if you have diabetes and fatty liver, like these are a couple of good options that you want to focus on that might be a little different than your regular diabetes drug therapy recommendations because it also addresses the inflammation part. They've done lots of studies looking at different vitamins, vitamin E, vitamin D, that they tend to be antioxidants. Sometimes people use some of those vitamins. They haven't had huge results, but they're certainly not harmful.
Vitamin E that sometimes is recommended, but I think it has also an increased risk of prostate cancer associated with it. So that's something where it's like having that discussion with your individual physician is going to be helpful because they may help you balance that risk benefit. As a
Right.
woman who does not have a prostate, that may be an acceptable thing. But if you do
Yeah.
have a prostate, then that may be something where the risk benefit is not as strong to say do that vitamin E therapy. So all important things. And so where I think this all leads is, how does someone know if they have this metabolic liver disease, this metabolic associated liver disease? How might they know this, or what tests might they ask for? How do we know if we have it?
Typically, we start like it's typically really an incidental finding quite often when someone's had some sort of imaging and they're just like, there it is. And then people are like, oh my gosh, what are you talking about? Or we start to see when we do blood work, we start to see our specific liver enzymes that tell us how our liver is doing start to creep up. They may be in what seem to be normal levels, but they're starting to creep up. And then eventually they may get to above normal levels. And then sometimes after many years, they'll normalize again because that's just their method of compensation. But we would suspect that maybe someone had MAFLD if they have those tenets of metabolic syndrome, which tells us that there's probably some inflammation happening in our body, and we're just that kind of picture of increased cardiovascular risk that's associated with metabolic syndrome, which is increased blood sugar. It may not be quite to diabetes yet.
So if someone has had blood work done recently, there's a couple
Mhm.
liver enzymes that are on labs that most people have gotten done at like their physical, or if you've been to the ER or the
Right,
hospital recently. And that is going to be your AST, your ALT, and your ALK phos. And so if any
right,
of those are a little elevated, that's something you should follow up on. And I find that
right,
sometimes in the busy medical world, if something is not severely elevated, right? If your blood sugar is just a little high, or your liver enzymes are a little high, or your cholesterol is a little high, that can get ignored, or
right.
there's not a conversation around that. So that may be something that you want to be proactive at. And nowadays,
Mhm.
most people have access to look at their blood work. Just take a peek and see, and ask your doctor some follow up questions friends, or see if you need any additional testing to look into your liver health. Because again, this
Mhm.
is something that really is not, I don't think, getting enough attention. And we want to know so we can track it, make sure you're not progressing. And that may be an extra push to say, even though your BMI is not off the chart in that obesity category, if we're starting to see this inflammation and this metabolic disruption in your body, that may be a reason that you do need to focus more on these lifestyle interventions and weight loss, because we do know that they work for this problem. And again, I think
Right.
it's a silent problem that people aren't talking about, people don't know to ask about, and that sometimes is not really getting the attention it deserves.
And what's really nice about an early diagnosis or just those early questions, asking as soon as you can, is that we can do non-invasive things and not expensive things. So we can do a very quick calculation. So if someone were to come and say, like, looks like my liver enzymes are a little elevated, I'm concerned about this. I have diabetes, I'm overweight, I seem to fit the picture. I have high cholesterol, hypertension. I seem to fit the picture of someone that might have this, and I'm concerned because I listened to this podcast. What do you think my risk is? And we can do a very simple calculation that's based off of the blood work that you just got. It's called a FIB4, and that gives us a good estimation of how much scarring is on the liver. And for most people, it's going to say very low risk, F0, F1, which means the very beginning, like there's very little scarring, there's nothing that's going to really concern you. But over time, that may progress, and it's very easy to do that calculation. And they have a couple of more NAFLD specific calculations, but the FIB4 is well known. It's easy to use. It's easy to find those calculators. And with no extra labs, imaging, any extra expense, we can do that and get a good idea of where that goes. And as that FIB4 number gets higher, it's less reliable for exactly how much it is. So it can say you might have some pretty significant scarring on your liver, but at that time, you would want to go with maybe some other ultrasound things to get a better idea of exactly how much it is. Because as long as it's in that early stage, that really low FIB4, there's really nothing to worry about except regular watching and watching for progression. And that is where most people will be most of their life. And it may give people some reassurance that, yes, we're looking at it, we're following it, and you're okay.
Yes. So that sounds like a good place to wrap up, where we should
Yes.
be aware of this. We can do some testing. All our lifestyle things are going to help keep our liver healthy, but also don't need to create a lot of fear, because for the majority of people, even if you do have some degree of this inflammation in
Right.
your liver, most people are not going to end up in that
Right.
liver failure stage. We don't want to just put our heads in the sand, and which kind of feels like what we're doing as standard right now.
Right. And often too, having those elevated liver enzymes, those liver tests can often scare a lot of primary care doctors, because you're like, oh my gosh, we have so many important drugs that go through the liver, and some are really beneficial to use in the metabolic liver disease and the statin drugs for cholesterol. People get really nervous to use those whenever there is any indication of liver, I would say liver failure, like liver dysfunction, but actually they're actually quite safe and recommended to use because they also help with some of that hyperlipidemia, lipid deposits. They take some of that out and help with that inflammation. And so there's often things that we can use that are totally safe, but people just get really nervous about. And understanding all the nuances of this is it's quite a feat for something that people, it's like it encompasses so many things, so many different systems. You've got your endocrine system, you've got all of your cardiovascular system, your gastroenterology. You just got everything that is in this, and it just gets to be a lot. And especially when we can't cure it, or it be really hard, and there's no medicines, and we're just watching it.
And then just other things we can generally do for our liver health. Alcohol previously was one of the biggest contributors and still is a huge contributor
Right.
to liver disease. And moderate alcohol use, which is currently described as less than 2 drinks per day for men and less than one for women, though likely we are going to see those recommendations go down, because I think we are
Mhm.
seeing that alcohol really has very minimal to no health benefits and lots of health harm. So I think our guidelines will reduce that further, but those are our
Yeah.
current recommendations. But for anyone who already has signs of liver issues, really trying to not drink at all is going to be the best
Yeah.
advice. And then watching Tylenol usage, which Tylenol is often a very safe medication. But if you already have some liver problems or you're taking more than is directed or you're taking it every single day, that would be another thing that make sure you have discussed with your physician if this
Mhm.
is the right amount of Tylenol for you, because
Right.
that medication can be hard on your liver, especially if you already have some liver disease going on.
Mhm. And it seems so easy just to pop a Tylenol. Most people do think it's really safe, but it definitely can lead to liver failure when it's done incorrectly. And especially when you're talking about using it in combination with either liver dysfunction or alcohol use.
So don't hear from us that we said don't take Tylenol. That's not what we said. But if you find
No.
yourself taking it frequently, definitely consult with your physician, because that
Right.
may or may not be the right choice
Right.
for a particular body.
Multiple times a day, multiple pills. That's where we're like, oh, you need to really be wary of that. And quite frankly, like even depending on the level of liver dysfunction, you may just need to have a real, like thoughtful conversation about any kind of like over the counter items or pain control anyway, because sometimes when liver function is really not good at all, that means other medicines that are even over the counter may not be safe. So it's really good to have that discussion because a lot of times we don't think about it. It is safe, or even some like herbs and supplements that really, if your liver isn't working at optimal capacity, could really be dangerous and could cause a much higher level of that in your body that it's not meant to be.
Well, Emily, thank you so much for joining me today. I will put your information in the show notes for people. And we have a little bonus coming up. We're going to do a little mini episode after this. So, we are going to talk about what to do about the shortages of current GLP medications like Wegovy, Ozempic, Saxenda, all these meds that are hard to get right now, and what you need to know about compounds. I'm going to put compounds in quote here of these medications. If you want to check out the next episode, we're going to have a little mini episode on that. Otherwise, until next week, take care.
Thank you for listening to the Dr. Francavilla Show, where we learn about all things related to weight and health. If you love this podcast, make sure to leave those 5-star reviews and share this podcast with a friend or loved one. If you have a topic about weight and health you want me to tackle, head over to the website, thedrfrancavillashow.com, to submit your question. And make sure to subscribe to the podcast so you don't miss next week's episode. Take care.